Welcome to Optonome CEO Corner. I'm your host, Dennis Dicker. Let's get started, shall we? With Optonome, it's important to stay at the forefront of what's going on in the home healthcare industry. The Optonome application helps clinicians and CEOs around the country manage their home healthcare services as they support adults with autism and other intellectual disabilities. Let's check out other news in the industry as it's related to HCBS services and other advancements in long-term care. The 2022 Direct Support Professional Recognition Week is coming up September 11th through 17th, 2022. All right. This happens every year. Most of the time, there are a lot of conferences that do recognize DSPs. They share with them opportunities for advancement and things like that. There's a huge opportunity to help DSPs as we are in a DSP workforce crisis. The need for DSPs for the next 10, 20, 30, 50 years is through the roof as more and more people age in place outside of these institutional type settings. All right. With Optonome, we do have the DSP 123 training to help onboard anyone from scratch to properly learn how to support someone with intellectual disabilities or autism. All right. Check out the DSP Recognition Week at the ANCOR website. ANCOR issued a statement on exclusion of HCBS investment from the Senate reconciliation legislation, and I knew this was going to happen. Too much was going into really trying to put funding in place for HCBS services. There was a lot of money that was released during the pandemic, which helped a lot of states improve rates for DSPs, also help them reflect on the types of services they are offering as they relate to other states. So it does give states the ability to see how that they can budget for themselves with current legislation to try to put together more money needed to support their citizens in their state. All right. New research examines DSP wage assumptions and rate setting. All right. With the DSP workforce crisis threatening access to services, the way states account for DSP wages during rate setting process is critical to ensuring HCBS services are available for individuals with intellectual disabilities. These rate settings are really important so that they're adjusted and the providers can actually provide a competitive service. If not, which is what's going on, some rates in certain states aren't really adjusting for the types of services that are needed, but they are being adjusted because of the pandemic, and more focus has been on HCBS services. Open Minds usually share some great articles. So for professionals in the home healthcare space or just healthcare space, definitely check them out. Recent article that was released was the new partnership. There has been 3 decades of discussion about the pros and cons of managed care models serving populations with more complex needs. Regardless of the discussion, the evolution of managed care has moved ahead, and of course it has. Anthem, many insurance companies are focusing on managed care and really trying to get into the home healthcare space, even though I actually interviewed a couple of their leading managers, and they had no clue years ago. But with money, I'm pretty sure you could learn more. Of more than 80 million Medicaid beneficiaries, about 85% or 67 million were enrolled in some type of Medicaid managed care. All right, managed care is growing through the roof. 66% of consumers with IDD have their health services provided by health plans. All right, 3.8 million consumers are enrolled in Medicare Advantage plans. All right. So there's a lot of people that are really enrolled in these managed care plans where they're further partnering with you all, the home health care providers, or the organizations that you work for. With Optonome, you can actually be the boss and have those referrals come directly to you because, again, you are local. You are from the community and you're able to understand more about your community than a large organization like these big insurance companies. Another big opportunity in the news is creating a peer support workforce. Peer-to-peer support, peer-to-peer communication, peer-to-peer sharing is always the best opportunity, all right? Especially peer support, especially as far as different types of abuse but as far as supporting in the workforce, there is an opportunity there for people to educate one another and be able to support each other to increase their wages, as well as support at a higher standard than what's available as far as regulation or other providers in your state. Hopefully that makes sense. All right, so as far as North Carolina, they created a new service where families can become kind of like the case manager and support their loved ones or other people in the communities. It's offering a pretty competitive wage. At the same time, the actual person is actively working. So with more and more advanced technology and us at Optonome, we're looking to offer a solution for case managers and for people to find activities and the proper support in their community. So hopefully they'll find Optonome to help their job become easier. The social determinants of health has been very important and is at the core of the business plan for CEOs using Optonome. Because a long time ago, less than 10 years, my agency was providing services, and I noticed that other agencies were also providing services, and all they do is just go into the home, provide their service for 1 hour or 3 hours or 8 hours. They go on with their lives. They didn't really care about the long-term effects or opportunities that the consumer or client can reach as far as their goals with the proper supports in place, right? And social determinants of health for a person is just that. It's really focusing on their whole life and providing solutions so that they can reach their goals. All right. And what I say all the time is, as far as a provider, a single provider, if you were by yourself without Optonome, how would you pay for such improving a person's social determinants of health? A single provider is not enough. That's why we have a network where we're able to collaborate and provide value at a high level. All right, clinical oversight, housing opportunities, job opportunities. Because the network is clinician focused and CEOs are at the forefront, we're able to really come together and provide different solutions that are valuable. All right. These updated news will be in the show notes. Please check it out. Thank you for watching. Please be sure to check out www.optonome.com. We have ways to get started. You can really understand all the great features of the Optonome application and the different industries it can be applied to. You can also learn more about how we got here, things like that, and our growing marketplace. We have integrative human services, Care in Minds, Helping Hands Health, Emerge Community Services, Trinity Health and Home, We Care Support Services, Hortus Health, Independence Fits You, Tandem Community Care, Inspire Home and Health, Pro Social Services. There are many more providers that are up and running. Thanks for watching, everybody.